Okay, hello again.
Hello
Sridhar.
again.
So we talked about what is glycemic index and glycemic load yesterday. You know, just like when we go to the dentist, we brush our teeth very hard the day of. What if the patients, when they come in to see the doctor, the previous 1 or 2 days, maybe they really watch what they ate and they didn't eat desserts and come here. So I think to see what it is over a long term, there are some tests. So do you want to talk about that?
Yeah, definitely. I mean, instead of eating three idlis, you can eat one idli and go and test your blood sugar and cheat on your
Try to impress
test.
yourself.
Try to impress your doctor, but can't do it with this one test that I'm going to talk about. And that's called the hemoglobin A1C test.
Yeah.
And I'm sure you've heard about what
Yes, we do it
hemoglobin
all.
A1C is. Yes.
We monitor patients with that. Yeah.
Yeah, so this is great. So you might ask, what is glycated hemoglobin? Well, when you have glucose in your bloodstream, when you eat sugar, then this sugar goes and gets attached to all of the proteins in your blood. And one of the most abundant proteins in your blood is your hemoglobin because it carries oxygen in your blood. And so it also gets glycated. Glucose attaches to the hemoglobin. And you know what? The half-life of the red blood cell in your body is about 3 to 4 months. So when you want to look at long-term effects of this glucose in your body, you can measure hemoglobin A1C because it will tell you how you've been eating or how you've been behaving in the last 3 to 4 months.
Yeah. So there's no cheating.
No cheating.
So we talked about hemoglobin A1C that is really reflective of several weeks of what the blood sugar was. Now, what's a good number?
Yeah, what's a good number? So, universally, hemoglobin A1C of greater than 6.5 is considered to be a diabetic number. Okay, so if you have a hemoglobin A1C greater than 6.5, you have diabetes, you got to go to your doctor and get it tested again, make sure it's right, and start, lifestyle changes, treatment, whatever it needs to be done. Now, there's something that you also have to look at, which is the pre-diabetic stage. So, A1C of 5.7 to 6.4, so the intermediate stage, is referred to as pre-diabetes. And if you know that you have a high risk for diabetes,
You'll
obviously
start making some changes.
changes.
So, what percentage of persons who have pre-diabetes go on to develop diabetes if they don't change something?
Yeah, if it's unchecked, and especially if you have a family history of diabetes, you really want to know that you have pre-diabetes because more than 30% of them actually
Go on
to get frank diabetes, and then it's too late. So you want to check it before there's increased complications.
And they may not
diabetes.
even know they are pre-diabetic.
Right. And if you have diabetes, you want to also maintain a good blood sugar range. So A1C of 7 is pretty good for a non-diabetic already. To maintain. And we know for a fact that if for every 1% increase in your glycated hemoglobin, the amount of complications you get because of diabetes, your eye, blindness in the eye, your cataracts, kidney function, all of that, heart disease, strokes, all of that increases 20%. And if you decrease your A1C, there's a relative decrease in the incidence of complications as well. So there you have it.
So I think the first thing we can do to modify, especially in pre-diabetic as well as diabetic, even weight control, is portion control and the mix of foods that you eat. And the diabetic associations all over the world have recommended a percentage of the plate, what it has to be, and what different components it has to be. So we'll do that and show some.
Yes, it'll be lovely to see a healthy plate as well as a diabetic healthy plate.
Yes. Fantastic.
Thank you, and I'll see you again.
See you again. When cauliflower is diced into small pieces to resemble cooked rice grains, It is called riced cauliflower. It is popular for several reasons. First, by color, consistency, and texture, it resembles cooked white rice. Second, it has very low calories. Third, it has no fat. Fourth, it is high in fiber and vitamin C. And finally, it takes very minimal time to cook. 1 cup of cooked riced cauliflower has 25 calories and minimal carbohydrate compared to rice that has over 200 calories. Very important is the low glycemic index of 10 compared to 60 of rice. Lower glycemic index means you can eat a larger quantities without raising blood sugar, therefore lowering the risk of diabetes, better control of diabetes, and also if you are trying to lose weight, it helps you lose weight. There are several ways to make the riced cauliflower, and first method is by grating. You take the cauliflower florets and pass it through a grater and you will get the diced cauliflower. The second method is by chopping it with a knife into small pieces, and again you will get the same result, but this is a little bit time consuming. The third method and easiest one is to just buy from the store either fresh or a frozen riced cauliflower, and this is how it looks like. So I'm just showing you how it looks like when it comes out of the pouch. You are supposed to cook it within the pouch, but I'm just showing you how it looks like. And the easy way to make is to pass it through the food processor, and this is just with 4 few short pulses you get very nice riced cauliflower. And now I will show you how to cook these. The first one is in a microwave. Normally we just leave it in the pouch and cook, but if you're taking it out, then you just put it in a microwave safe dish and cook it for about between 4 and 6 minutes. The second one is on the stove. You just put 1 teaspoon of oil. If you want, you can put some jeera and then put the cauliflower, and just it takes within 4 to 6 minutes it cooks well. Many of you after the last video have asked how to make the cauliflower rice and a recipe. And the plain cauliflower rice, you can eat it with curry, sambar, dal or dahi, or you can make it like with cauliflower saffron rice that I'm going to show you here, which you can eat with raita or any other accompaniments. Enjoy the cooking.